Hey, this is Ashton Legier. I'm a nurse practitioner student with Auburn University and Auburn University Montgomery, and I'm here today to talk to y'all about sciatica or sciatic neuralgia. This is a common condition in which one of the spinal nerve roots of the sciatic nerve is compressed, which results in pain in the lower back and buttock and sharp shooting pain in the leg. Usually, this is just on one side. The sciatic nerve arises from the lumbosacral plexus, and it is a huge nerve that originates from L4, L5, S1, S2, and S3. The most common cause of sciatica is a herniated spinal disc. With age, the discs become rigid and may crack, which allows the gel-like center of the disc to protrude out and become a herniation outside the normal boundaries of the disc. Disc herniation presses on the sciatic nerve root as it exits the spine, and this is what causes the pain. Most likely to happen between ages 30 to 50 as a result of general wear and tear of aging or any sudden pressure on the discs. A typical sciatic pain is described as a sharp shooting pain in the lower back, down the buttock, thigh, and leg on one side of the body. There may also be numbness, burning, and tingling sensations. The pain can get worse with sitting, moving, sneezing, or coughing. The patterns of pain depend on which nerve root is compressed and follow the dermatome distribution. The questions you want to ask your patient are: where is the pain located? Is there numbness, burning, or tingling in the affected leg associated with this pain? Is the pain worse with sitting, standing, coughing, or sneezing? Does standing relieve the pain? For sciatic pain, you would expect the answers to be yes to all or most of these questions. As far as assessment and physical exam, you would definitely want to do a thorough pain assessment. And you could also do the straight leg test. And this is how you do this is with the patient either sitting or supine, mostly supine. You will raise the leg, and that will reproduce the pain and paresthesia when it is raised to a 30 to 70 degree of hip flexion. Similar to the straight leg test, sitting by itself will place tension on the nerve or stretching of the nerve, and that will cause discomfort. And that's kind of an indicator of sciatica. And then there's also the Lasso's sign, and that's when you straight leg raise and the pain is aggravated by forced ankle dorsiflexion. We could also do an MRI to confirm or determine the area of disc herniation. If the MRI does not correspond with a disc problem, the pain is probably from piriformis syndrome rather than sciatica, and treatment options are different. As far as treatment goes for sciatica, in the majority of cases, the condition resolves by itself after a few weeks of rest and conservative treatments, such as pain relief with anti-inflammatories and muscle relaxants, as well as stretching exercises and physical therapy. We would consider surgery if the pain remains after 3 months of these conservative treatments, and surgery options would include either a discectomy or a laminotomy. You would want to educate your patient on the fact that the condition usually heals itself, giving sufficient time and rest. They may find it soothing to use gentle heat or cold on the affected leg and muscle. We would want to discuss exercises to strengthen their back. Let them know it is important to walk and move, but limit too much bending or twisting. It is acceptable to perform routine activities around the house, such as cooking and cleaning, but definitely let them know that most of the time this condition will get better within a few weeks of these conservative treatments. All right, thank you. I hope this was helpful.